it's an action among the cancer community, the governments, the healthcare system, the research institution, cancer societies, patient advocates, and citizens. I think we need to continue invest in prevention, in innovation, in equity, because we need to address all these challenges and we need to reduce the disparities in access to screening, to prevention, in access to treatments in Europe. So we need to be aware that it's not only to have a great screening programs, we need to have also take care of the rest of the patient pathway if we want to have a high quality standard cancer care. Thank you. Thank you for the introduction. When actually I'm the past president of the European Society of Surgical Oncology, and the president is seated there. So let me just talk a little bit about what is Europe doing in terms of preventing and early detection. So you can see here the number of new cancer cases in Europe that are growing like in every other continent. And cancer is the second leading cause of mortality in the European Union. But also, if we look into the picture, Europe accounts for 1/10 of the world's population, but 1/4 of the world cancer cases are in Europe. So it's a burden that we are carrying and we need to really fix. So 1 in 2 European citizens will be diagnosed with cancer during their lifetime. And this is not only a problem with patients, with population, with individuals, with families, it's also a significant burden in the healthcare systems, in the labor markets, and in the economy. And the total economic impact of cancer in the European Union is estimated to be over 100 billion per year. So in 2021, Europe developed the Europe Beating Cancer Plan in response to this cancer burden and in the meaning of trying to reduce and give better outcomes to cancer patients. It's I'm not going to go into it, but it has 10 flagship initiatives and it's with 4 pillars, and we are just going to talk about the 2 first pillars, prevention and early detection. So I'm just going to give a very brief view of what we are doing in Europe. For example, for cancers produced by the HPV. So one plan in Europe has been to try to increase the vaccination for HPV cancers. And as you can see here, one of the main problems in Europe is the great disparities between Western Europe, Eastern Europe, Northern and Southern. As you can see here, that in some countries in Europe, they are doing vaccination in girls and boys. In another ones, it's only for girls. And in another ones, like in the Eastern countries, there is no vaccination programs. So after the Europe Beating Cancer Plan, this project has been funded by the European Commission, trying to eliminate the cancer caused by HPV through the vaccination. It's a funded program that has been done trying to achieve the goal of having a vaccination in 2030 of at least, in the majority of the European countries. And since the program has started, there are at least 3 new countries in Europe, like Iceland, Portugal, and Norway, that has reached the target of 90% HPV vaccination coverage among girls by the age of 15 years. So this is one of the successful things about this program. Still, there are many countries who are not vaccinating boys, but they are in the way of it. And we know that organized screening programs, there is evidence that it reduces mortality for cancer. And not only that, but also cancer is detected earlier. So less treatments, better quality of life, and better oncologic outcomes. What about alcohol? Well, you can see here numbers about the consumers of alcohol in Europe. Europe is a big industry for mainly wine. And this here is divided by employed, unemployed, and everybody. But you can see that the rates are high. So in Europe, 1 out of 10 cancers in men and 1 out of 33 cancers in women will be as a result of alcohol consumption. And we know that it's a risk factor for at least 7 cancers. I'm not going to go into how much do you need to drink for increasing your risk. But there are some data that says that no drink is better than just moderate or small drinking. What is Europe doing? Well, they have understand that there is a need for warning labels in the alcohol bottles. And this is a study that they did with 19,000 participants in 14 European countries, trying to identify if they can raise awareness of the risk of alcohol in developing cancer. And you can see here that the results of this survey was that all these cancer messages in the bottle was perceived that will impact and will raise awareness in the population. What about tobacco? The European Commission is trying to bring this revenue from tobacco excise duty. This is something that they are looking into introduced in the new multi-annual financial framework, that it's the budget of the European Union for 2027 to 2035. And they are still working on this. You know, it's not an easy task, but they are trying to get a revenue from the tobacco to just help in the health policy objectives. So what about the screening? Since 2003, that was the last recommendations for screening in Europe. Now they develop these new screening programs. They increase the screening the cancer screening in breast cancer to age 45 to 75. They also, increase the cervical screening programs and the colorectal cancers. But they have introduced 3 new screening programs that we will go a little bit through them in lung, prostate, and gastric cancer. So this is a study index that has been done by the European Cancer Organization. And you can see here that same problem that we saw with the HPV vaccination. In Europe, there are great disparities in terms of the screening programs. And there are still some countries, mainly in the Eastern Europe, where there are no cancer screening population programs in place. Even though it's advancing and it's expanding, we are still lacking. And you can see the colors are very meaningful. You can see some red colors there and some green and some yellow. So we really need to keep working and to implement the new screening programs, but also to adapt programs in those countries where there are no programs. But also participation in the programs is a challenge. Even, and I can talk about Spain, that is my country. Even in Spain, breast cancer screening programs are in place since the 90s. And the uptake for the first call is around 80%. The next calls, the follow calls, are below 60%. So this means that, we really need to engage the woman to get the screening programs, even if it's a program that it's already working and in place for the last 3 decades. The European Union continue to play a role in terms of the new recommendations and the new pilot projects. you are not supposed to read this. I just want to show you that part of this European Cancer Screening Policy Index from the European Cancer Organization, we look into the different European countries, and there are several quality indicators that can be taken into consideration, and there is a lot of data of the screening in the different cancers in the European Union member states. We know that mammograms for screening breast cancer reduce mortality, and this is important, and reduce mortality across all ages. Of course, we need to also account for the treatment. So if we combine screening and treatment, adequate treatment, we will have a reduction in mortality across all ages in breast cancer. So there are some still problems and experiences that we need to take into consideration. The inequalities are really something that is important in Europe. Sometimes in some countries there is insufficient national coordination and monitoring structures. There are also gaps in the workforce capacity and training, and we know that that happens in many other continents. Low levels of public awareness and trust, and sometimes, lack of integrated data systems. And in Europe, there are some countries that has very good data registries, like the Netherlands, but there are others who do not have any. What about colorectal cancer? Same thing. We know that early detection improves survival, and this is some data from Europe. And there are some good practice that we are developing in Europe for cancer screening, like mobile units for those rural areas, testing, mainly in the northern part of Europe for HPV, and generating awareness and communication. As I was mentioning, there are 3 new cancer screening programs that are being funded as pilot studies. This one is PRAISE-U for prostate cancer, that it has been already proved that with a screening program, you can reduce the mortality. The SOLAS for lung cancer, also a pilot program that, as you can see on the left map, there are many countries that are participating in this program using the low-dose CT for screening. And interestingly, in this study, 55% of the participants are women, and it seems that women are probably the ones that most benefit from this low-dose CT screening. So the programs are already finished, and now the next step will be to implement them in the countries. I don't know. Okay. And the last screening program that is new is for gastric cancer, and this is the TOGAS project, that it's screening for Helicobacter pylori and surveillance of precancerous stomach lesions. So, I think that Europe since the Europe Beating Cancer Plan has made major advances in prevention and screening and early detection, because this was one of probably the most funded pillars in the whole program. But still, about half of the new cases have limited or no early screening. And we have here some of other tumors that cause mortality, but still do not have any type of screening. And this will be probably the next issue. I just want to mention that in Europe, we have the European Code of Cancer Practice, that is a citizen and patient-centered manifesto of the core requirements for good clinical cancer practice. This has been reviewed, and the new edition will be presented in November at the European Cancer Organization. It has been produced by all the stakeholders involved in cancer. So the Europe Beating Cancer Plans aims at reducing the burden cancer while promoting health equity. It's an action among the cancer community, the governments, the healthcare system, the research institution, cancer societies, patient advocates, and citizens. I think we need to continue invest in prevention, in innovation, in equity, because we need to address all these challenges and we need to reduce the disparities in access to screening, to prevention, in access to treatments in Europe. So the increased update of the recommended screening strategies will help to reduce the burden of cancers, and the full benefits of early detection can only be achieved if it's converted into an optimal cancer diagnosis, treatment, and care pathway for cancer patients. So we need to be aware that it's not only to have a great screening programs, we need to have also take care of the rest of the patient pathway if we want to have a high quality standard cancer care. So, takeaway message, the Europe Beating Cancer Plan has helped in doing regulation for prevention, also in increasing the population screening programs. We need to take into account that breast, colorectal, cervical, lung, prostate, and gastric cancers account for 53% of all the new European citizen cancer cases and half of cancer deaths in 2024. We need to reduce these inequalities, and this remains critical if we want to advance. And as I mentioned before, treatment and screening will make a really impact on the outcomes, on quality of life, on cancer patients.